Hello, my name is Kelly Tebow, and I'm with the New Jersey Center for Tourette Syndrome and Associated Disorders. I will be your organizer for this evening, and I would like to welcome you to our webinar on exploring and managing the impact of ADHD across the lifespan. Thank you all for joining us. Before I have my colleague introduce the speaker for tonight, I'm going to cover some housekeeping items with you. All participants are muted. If you have a question, please type it in the bottom of your question box and click send. You may send questions during the webinar. However, we will have Dr. Murphy answer the questions at the end of her presentation. We will get to as many queries as time allows. In addition, tonight's presenter is available to take your questions on the Wednesday webinar blog, which is accessed from our homepage under the heading Programs. This blog will be monitored for the next 7 days. Feel free to look and post questions as often as you like. Answers will be archived for future reference. If you missed part of the presentation or would just like to watch it again, an archived version will be posted to our website shortly. We value your input, and in order to expand the webinar experience in the future, we need everyone to fill the survey out when you exit the webinar. The New Jersey Center for Tourette Syndrome and Associated Disorders, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now I'm going to turn over the introduction of our speaker to Pat Phillips, the Education Outreach Coordinator of NJCTS. Pat?
Yeah, thanks, Kelly. And good evening, everyone. We are so delighted you can join us. But before I introduce tonight's presenter, I'd like to take a moment just to draw special attention to a few upcoming events. March 9th, 3 to 6 p.m. is our winter pool party at Medford Fitness. That's 3 Nelson Drive in Medford, New Jersey. So you can sign up on our website at www.njcts.org. It's a great opportunity to join the TS community and help chase away the winter blues. Also, if you have a child interested in advocating for themselves or others with Tourette syndrome, there are 2 training opportunities coming up. February 23rd for ages 13 to 18 and March 23rd for ages 10 to 12. Both are being held at the Bridgewater Public Library. You can also sign up at our website again at www.njcts.org. Now, to the introduction of tonight's presenter, Dr. Hilary Murphy. Dr. Murphy received her Ph.D. in school psychology with a concentration in pediatric neuropsychology from Fordham University. She currently works at the Center for Neurological and Neurodevelopmental Neurohealth, also known as CNNH Neurohealth. Dr. Murphy specializes in the neuropsychological assessment of neurodevelopmental and neuromedical disorders. She has extensive experience evaluating children, adolescents, and young adults. As part of her training, she participated in interdisciplinary treatment teams on an inpatient and outpatient context to treat clients presenting with a variety of neurological, neurodevelopmental, and psychological needs. Dr. Murphy's training in school psychology provides her with expertise in collaborating and consulting with educators and other professionals to develop comprehensive, individualized educational and treatment plans. She adopts a multifaceted approach to neuropsychological assessment, which takes an individual's culture, social, emotional functioning, cognitive profile, and academic performance into account to develop a holistic understanding of each patient's unique presentation. Dr. Murphy, we are so pleased to have you join us on our Wednesday webinar lineup. And now, without further introduction, I'm going to turn tonight's presentation over to you.
Thank you so much, Pat. And good evening, everyone. I'm so excited to be able to reach out to you and talk about this topic because I think it's something that's so important to so many of us, especially because it impacts so many individuals within our society. Now, as part of our seminar tonight, there are specific objectives that I have that I'd really like to be able to cover. The first one concerns reviewing all of the outcomes that we typically associate with individuals who have attention deficit hyperactivity disorder, or ADHD, including those affecting occupational attainment, academic achievement, social emotional functioning, as well as later interpersonal skills. I'd also like to talk about what are the unique clinical features of the adult ADHD presentation. How do these individuals differ from what we see in children who have ADHD? And finally, I'd like to discuss what the role of neuropsychology is in treating individuals with ADHD across the lifespan, as well as a discussion of some of the available treatment options across different areas of life. Now, as we move forward, you're going to hear me refer to very specific terms, and I want to just take a moment to review what I mean by a lot of these different words when I use them during our presentation this evening. Now, the first one is attention, which I think we talk about a lot in our daily life, but we don't take time to really consider what we mean by attention. Now, from a neuropsychologist perspective, attention refers to our level of arousal or alertness. How well can we sustain our focus on a given subject for a period of time? Now, on the other side of that coin, we have inattention or distractibility, which refers to a deficit in an individual's ability to sustain focus for a period of time. Now, hyperactivity is essentially just what it sounds like. It's an elevated level of motor activity, and it's important to distinguish that this feature has to be unusual for the situation and has to have a significant functional impact on the individual's functioning. Now, the reason that I stopped to really emphasize that is that we see many individuals who have a high level of activity in certain situations that's completely appropriate. And we see a lot of individuals who have a high level of activity and it doesn't interfere with their daily life. Now, finally, impulsivity refers to hasty actions, essentially acting without thinking. And we're going to talk a little bit more about how that looks in adulthood, because we often think about something like impulsivity in terms of blurting into conversations, but it's really far more nuanced than that. It's actually also involved in things like being able to delay gratification, being able to think longer term in terms of goals, and being able to resist immediate distractions or reinforcers. Now, when we talk about just general onset for ADHD, we know it's somewhat common in terms of our general population, occurring somewhere between 5 and 7% in the population as a whole, with boys being far more likely to be diagnosed than girls. Now, in children, hyperactivity is usually the first clinical sign that's brought to attention, and that's simply because it's the most noticeable. We often see children who are extremely hyperactive because they tend to stand out in a crowd. Similarly, impulsive behavior tends to also be very easy to recognize because it has a very negative impact on just day-to-day interactions with other individuals. Now, when we talk about maturation over time, we do see that there's a large number of people who are diagnosed with ADHD in childhood who later outgrow the diagnosis. Essentially, they don't meet criteria for a clinical diagnosis over time. And there's a lot of different variables that may contribute to that. And we'll discuss them a little bit later on in the presentation. When we talk about biology, and I promise not to bore you with all of the details, but we typically think about dysfunction occurring in the prefrontal cortex, or in the frontal lobe of the brain. That's essentially the foremost area of our brain that's right behind our forehead. But we know that the brain acts in concert. Many different areas are involved in producing all different kinds of behavior. What that means is that even though we know that that area of the brain tends to be specialized for attention, in order to produce all of the different things that we need to just pay attention in a classroom, for example, many different areas of our brain are involved. And we know that these networks can be very, very sensitive to a lot of different factors. It's why when we're hungry or tired or in pain, a lot of times the first thing that we see is that there's disruptions in our attentional functioning. It's also why many different disorders, whether it's physical, whether it's neurocognitive, we often see attention and executive functioning being really significantly impacted, even if there's no evidence of impairment to that part of the brain. Now, in addition to what we think about in the frontal lobe, we also know that there are very unique features that tend to be differentiated in individuals who have ADHD and individuals who don't. Those include things like differences in the metabolic functioning. So we also can see differences in how our brain processes certain chemicals, particularly dopamine. And we can also see that there are structural changes. So if we look at the brains, there are just different areas that are either larger or smaller or more active or less active. So again, it's something that's a whole brain that's interacting together, not just one little area. Now, I want to talk a little bit more specifically about what exactly are some of these negative outcomes that we can think about with ADHD. We know that for many individuals, they'll experience limited academic achievement. They are at higher risk for social rejection as well as peer victimization. As adults, we see lower levels of occupational attainment, and we often see a lot of difficulties in consistently maintaining employment. There's elevated levels of interpersonal and social conflict. But one of the things that we do know is that better outcomes across all domains when we look across time tends to be associated with appropriate diagnosis and treatment in childhood. And that leads us into the topic of pharmacology or medication to address the core features of ADHD. Now, this talk is not going to focus on debating the merits of medication as opposed to not. Really, what I want to focus on here is I do want to highlight that there is research that does suggest that individuals do experience a positive effect from having medication. Many individuals see a reduction in the core features of ADHD, including the impulsivity, the inattention, and the hyperactivity after using medication. And that there's some evidence that there may be neuroprotective factors, that the brain is able to grow a little bit better, and that oftentimes we'll see that the brains of people who have ADHD and receive treatment are more similar to those of the unaffected population, essentially people who don't have ADHD. We also know that longer-term studies show that people who have been treated, who have gotten some level of treatment, have far better outcomes. So this is just to say that for many individuals, we can see that their likelihood of reducing some of these negative outcomes that we talked about a moment ago can be reduced by having appropriate treatment as children. Now, we see that there's a lot of different areas that can be affected in people who receive appropriate treatment. We see that people who aren't treated, they tend to have reduced self-esteem, they have poor social functioning, they have a lot of interpersonal difficulties, and again, they're more likely to experience bullying. Now, when we look at the cognitive aspect of this, many studies have found that treated adults tend to have outcomes that are more similar to the general population. So what that means is that we're reducing the negative effects of the ADHD through treatment. Now, since we know that other neurocognitive functions, things like memory or learning, they're highly dependent on how well we can sustain our attention, it's not surprising that when we look at the research on cognitive functions, which we're going to talk a little bit more about in a little bit later, we tend to see what we call a secondary benefit. Essentially, because your attention is better through treatment, you can access your memory. You can better demonstrate your potential because we're removing the barriers that may stand in your way. When we think about social emotional functioning and self-concept, we know that for many individuals, the core features of ADHD tend to elicit negative reactions in both peers and adults. What I mean by that is that the features such as hyperactivity or impulsivity in social interactions, they can cause other people to think that someone is bossy. They may think that someone is inconsiderate. Think of a child who can't stop themselves or can't wait to take a turn in a game. They might blurt things out. They may try to, jump the line if they're waiting for something. And that's going to have a really negative impact because other people around them aren't going to want to spend time with them. Similarly, in adults, a lot of these behaviors can be misperceived as a child being purposefully disruptive. And as a result, these children can be socially isolated if they're rejected from their peers, or they can be at risk for having a lot of really negative interactions with adults, people like teachers or administrators who may unwillingly give them far more punishments because their behaviors are something that's very disruptive in the environment. Now, when we look at some of the outcome research, we tend to see that children demonstrate more difficulties in social and interpersonal outcomes if they aren't treated appropriately. Adults, however, exhibit far more profound negative effects on their sense of self-esteem. And it's likely that that is due to the number of instances that adults have experienced negative interactions with others. We also know that having reduced self-esteem and having a lot of the social emotional difficulties or the comorbid mood symptoms, the co-occurring mood symptoms, has been related to individuals using maladaptive strategies. They're more likely to be avoidant of tasks. They're more likely to put things off, and that's going to compound all of the difficulties that are already there. Now, when we look at some of these outcomes, we know that there are very specific factors that tend to really be the things that are driving some of these more negative findings. These are related to impaired social skills in individuals, less interpersonal engagement, and weaker social networks. And again, knowing that there may be the likelihood that we get really negative feedback from those around us, this isn't surprising. Combine this with just some of the social weaknesses that we can see from an individual who perhaps doesn't take the time to read an individual's facial expression, or may really stop from inhibiting themselves and blurting things out in conversation. And it's not surprising to see these kinds of social and interpersonal workings kind of coming together. Now, when we talk about ADHD in adulthood, it's a really unique presentation. And while it does maintain some core features, which we're going to talk about in a moment, there have been many researchers who have taken time to establish what is the unique contributing factors that we see in adults with ADHD that differentiate them from their child kind of peers in this disorder. We know that upwards of 1 to 6% of the general population of adults do exhibit some symptoms of ADHD. Now, over time, what we see is that the hyperactivity that really comes to attention in childhood, that tends to fade away. What presents far more prominently for adults with ADHD are deficits in aspects of executive functioning. Now, we're going to talk about executive functioning in far more depth in a moment, but just to provide a quick overview, executive functioning refers to an umbrella term that encompasses many different cognitive skills that are required for self-sufficiency, things that are extremely important both in school and at work. Think of things like our time management, our ability to get tasks started, our ability to sustain attention even on tasks that are very tedious or mundane, our attention to detail, our emotional regulation, all of these things that are extremely important to function independently are tied together in this executive functioning system. Now, there has been a lot of research to look at what is the validity of a diagnosis of adult ADHD? Essentially, how do we know that some of these people are continuing to experience the same disorder over time? Well, we know that when we compare the neuropsychological profiles of children with ADHD, they tend to be very, very similar to the adults that we assess. Similarly, the clinical manifestations, what we see in day-to-day life, those tend to be very similar also. We also can see that there are specific structural and functional brain abnormalities that persist over time. We know that there's definitely a familial or genetic link. We see that ADHD tends to run in families. And we know that adults tend to respond to similar medication treatments that we use in children. Now, what we see that's very interesting about ADHD is that unlike in childhood where we see that boys far outnumber girls about 6 to 1, in adults, it's actually quite equal. Now, one of the theories that has been put forth to help to understand why we see this significant difference in terms of gender is that boys and girls may exhibit different features of the disorder. So girls sometimes are a little bit less hyperactive. They may not pick up as much. They're more likely to be socialized to be, very sweet and social. And so we don't see those behaviors as problematically as we see with boys. And that may also explain why, as they get older, the inattention and the executive dysfunction, that has been underlying all of that hyperactivity in boys starts to even out. Once we take the hyperactivity away, we see kind of the core aspects of this disorder. And we do see that regardless of the subtypes of ADHD, which just for a quick overview, we know that when we diagnose attention deficit hyperactivity disorder, we usually like to specify, do we see primarily hyperactive and impulsive behavior? Do we primarily see distractibility and inattention? Or do we see a combination of both of those features? It's far more likely to see the combination aspect of it, but we know that regardless of the subtype that we may look at, these individuals have less education, they have more employment difficulties, and they're more likely to experience negative emotional and mood-related symptoms. We also see that as adults, we see a lot of changes in employment, there's a lot of social maladjustment, and in terms of marital status, there's a higher rate of separation. Now, there are three different models that we're going to talk about just very briefly that have aimed to identify the unique features of adult ADHD. The first one being the Utah criteria. And as you can see on the slide, many of the features that we associate with childhood ADHD, things like that motor hyperactivity and the attention deficits, well, they're consistent. It's exactly what we would expect. What's unique about the adult presentations is that these criteria also involve the emotional aspects of this disorder. So you can see that reflected in the affective lability, essentially the up and down mood, also referred to as having a hot temper, and the emotional overreactivity, which is also known as stress intolerance. Now, because these are two of the more unique aspects of it, I do want to go into these a little bit more just to clarify. Now, when I talk about a hot temper, this refers to frequent angry outbursts or high levels of excitement or exuberance. They tend to be quite quick, but very, very intense. And although these episodes will pass very quickly for the individual with ADHD, there may be lasting impacts for the individuals around them. Think about it, if you have a really rough day, someone cuts you off in traffic, you start yelling and screaming, you get really upset. You may then be able to console yourself very quickly, but your passenger may be very surprised at your behavior in that moment. Now, many individuals who will experience these very brief episodes will talk about feeling like they're out of control in this moment, that their emotions overwhelm them to the point of feeling like they cannot stop themselves. When we talk about the emotional overreactivity, this is essentially a higher level of stress than would be expected for seemingly benign or situations that aren't really stress-inducing for many other individuals. So essentially, these individuals struggle to take everyday stresses in stride. Essentially, if we think about the straw that breaks the camel's back, this is the straw that always breaks the camel's back. The camel's back is always broken. Now, one of the things that can be really difficult also is that when we have these emotionally charged situations, so when individuals are essentially very upset or extremely stressed, we know that that's going to then reduce their ability to pay attention and exert control over their behavior. So it's going to add to all of these underlying concerns that are there because they have ADHD. Now, in addition, the Utah criteria also pulls in disorganization, which is aimed to pick up on some of the executive deficits that we'll talk about in a moment. And we also see the recognition of impulsivity and recklessness. And I think that in adults, it's very important to recognize that impulsivity now goes beyond just blurting things out in conversation. Now we're talking about instances where a person may have really questionable spending habits, or maybe has very foolish business practices. They don't think things through. That is also a feature of impulsivity because essentially individuals don't stop themselves from their first knee-jerk reaction. Now, similarly, Brown's model of adult ADHD also ties in many of the features that we would associate with child ADHD in terms of sustained attention, energy, and effort, as well as managing active and affective interference, essentially being able to regulate our emotional responses. But this also involves things like our working memory, which aims to pull for our ability to access our memory more generally. When we think about working memory, think about active memory. If you had to remember a phone number for, before we had cell phones and we still had to remember numbers before having to go and dial it, you'd be using your working memory. If we don't practice that information over time, it kind of just drops away. But if we practice it, then we'll remember it because we transfer it to our long-term memory. So again, Brown's model is trying to be more inclusive of some of the features that we know may impact an individual in terms of their adult functioning. Now, when we go to the Copeland model, which is the last one we're going to talk about, this also pulls in the emotional difficulties, but also takes into account the impaired family and peer relationships that can be there, the sense of non-compliance and frequent underachievement. And that includes not just academic underachievement, but also occupational achievement, as well as the features that we've seen more and more. Now, Copeland's model goes on to talk about a lot of the careless errors that can also be seen in individuals who have ADHD. So if you have to prepare a report for your job, you may be the person that, gets all of the information in there, but there's typos or there's small mistakes that really are just due to not paying as close attention as we would want. Similarly, it also recognizes the impact of risky behaviors, things like those foolish business practices we were talking about before, or more impulsive actions that may impede an adult's functioning more generally. Now, I continue to refer to this phrase of executive functioning. And like I mentioned a moment ago, there is no specific direct definition of what exactly this umbrella term refers to. It's a pantheon of these higher order cognitive processes. And the key here is that they're all required for what we refer to as goal-directed activity. They're all required for us to be able to reach a specified goal, whether that's graduating high school, whether that's getting a specific job, or whether that's just paying all of our bills on time by the end of the month. Now, because they're all related to our goal-directed behaviors, these are the skills that we have to draw on, especially in late childhood and early adolescence, when we start to take on a lot more responsibility academically and socially. Usually in this point in education, students are expected to not just have to worry about learning the material, but they have to manage educational demands. They have to keep track of academic deadlines. They have to divide up tasks and make sure that they have enough time to finish them. They have to proofread their work. Essentially, learning shifts a little bit from being a lot more teacher-driven to being far more student-driven. And this is, in essence, to help to prepare individuals for the kind of demands that they'll see as they move through adolescence into young adulthood and start to enter the workforce. Now, these kinds of skills, like I had mentioned before, include things like our ability to inhibit our impulses, our ability to regulate our behavior, our ability to sustain ourselves and follow through on tasks, but it also includes things like monitoring our performance and our behavior. What do I mean by that? Well, we have to be aware, how well are we doing something? And we also have to be aware, what is the impact that our behavior is having on other people? If we can't read the room in the moment and perhaps change what we're doing in that moment based on situational demands, maybe change our tone of voice, change the way that we're speaking, that's going to have a negative impact on our ability to socialize with other people. It also includes more straightforward things like time management, organization, and planning. Now, what's very interesting about this is that executive dysfunction has been found to have a unique contribution, particularly to academic achievement. So essentially what we know is that people with ADHD who also have executive dysfunction are far more likely to have significant academic difficulties despite being capable students. So this is despite, being very well versed in the material. It's essentially the attentional and executive weaknesses that get into someone's way. We also know that these tend to be somewhat stable over time. There's a lot of newer research that's coming out trying to understand, are these deficits that will emerge at a certain point in development, or do we see them coming hand in hand with ADHD? Because we know that many people with attention deficit hyperactivity disorder exhibit a lot of these executive weaknesses, but not every single person. What we know right now is that individuals with ADHD and executive dysfunction are far more likely to have a lot of issues in terms of their academic and occupational achievement, because it's essentially a double dose of weaknesses. Now, again, like we talked about a moment ago, there is this unique predictive factor that is related to executive functioning. And one of the reasons that researchers have put out there is essentially we know that at a certain level, executive functioning skills begin to be drawn upon, not just for an individual to be able to organize themselves and keep track of what they have to do, but in order to complete the academic task itself. So for example, reading comprehension. When a child is reading a chapter in a book, they have to keep all of the details in their working memory. They have to know who the characters are. They have to be able to quickly retrieve what certain words mean, especially if they're unfamiliar terms. They have to sustain their attention for periods of time. And they also have to inhibit themselves from engaging in distracting things. So if they're sitting on the couch and reading a book and their dog comes running up to them and puts the toy in their lap, they have to be able to inhibit the impulse to play with the adorable dog and focus on the book that they're reading in that moment. And we found that executive functioning skills are related to all areas of academic functioning, including mathematics, especially for word problems and higher level math. Written expression is an especially executively demanding task that requires many different cognitive processes. And like I mentioned before, reading. Now, I had talked about procrastination as one of the maladaptive coping strategies that individuals with ADHD tend to rely on, especially when they have a lot of issues in terms of emotional functioning. And one of the reasons that I wanted to really pull this one out and focus on it for a moment is simply that many of the clients that I work with, especially high schoolers, this is probably the most common concern that parents will relate to me. They'll say to me, oh my goodness, I don't understand why they can't just get it done. They just put it off, and they tell me they have time, and then it's 5 minutes before it's due, and all of a sudden it's a meltdown, and I don't know what to do. And what we know is that procrastination is actually associated with a distorted understanding of the time that's available to the individual, as well as how long it will take to perform a given task. So if I say to a child that I'm assessing, I may say, how long do you think it takes most adults to write a one-page letter? Occasionally, I'll get answers that range from 2 hours to 15 seconds. And again, it's this distorted understanding of exactly how long they may need. Now, again, one of the things that we can see is that when there's a mood component, especially anxiety, procrastination and avoidance is a hallmark of anxiety, because we avoid the things that make us nervous. And when we avoid the things that make us very nervous or upset, we start to feel relief. You know, if you've ever had plans with a friend that the day of, you're like, oh my goodness, I'd love to just sit on my couch and do nothing. I don't want to go out. And then they call you or text you and say, I can't meet tonight. And you feel this sense of immense relief because you were able to avoid something that you didn't want to do in the moment. Well, it's no different from feeling that same level of relief when you're dreading having to start a term paper. Now, essentially, individuals stop relying on both internal and external cues to help them to understand when should they start a task, when should they keep going, and that really has significant issues in terms of academic and occupational achievement particularly. We've also seen that procrastination itself is linked with a lot of different skills. So I mentioned the anxiety a moment ago, but we also know that it's related to impulse inhibition and our self-monitoring. So when I talked about being aware of our performance and aware of our behavior, that's what we see. Now, in other words, when we think about the relationship between some of these variables, we see essentially that Procrastination can be summed up as a failure in self-regulation. Individuals will struggle to resist the short-term or social temptations, or they'll favor immediate rewards rather than thinking long-term. So going back to the example of the child on the couch and the dog coming over to play, well, a child really wants to play with a dog rather than having to continue to read the book, but being able to stop themselves and recognize, if I just finish the chapter, then I can go and play. That's essentially what we're talking about here, is that individuals who are procrastinators tend to have a lot of difficulty resisting that immediate reinforcement. And like I mentioned before, we see that there's a very strong relationship with mood, and it tends to be a coping strategy when we have co-occurring attention deficit hyperactivity disorder and mood symptoms, especially when it produces anxiety. Now, what's also interesting is that when we see individuals who have ADHD and depression, the primary driver for procrastination is actually the fatigue, the actual bodily fatigue that many individuals will report experiencing. And what we hypothesize drives that is that when we feel fatigued, it takes far more energy to produce or engage in even simple tasks. So that essentially just makes them more aversive, more unpleasant for an individual to engage in. Now, when we think about some of the areas that we can see being impacted, especially for adults and young adults, we think about work and occupational achievement. Again, thinking about what a lot of my patients will talk to me about. Many parents are so worried. My child is so bright, but they just can't get it done. And I have to tell you, if I refer back, to my own experience, as a young teenager and a young adult, I know that my mother would have been a very similar parent. Essentially, she used to lovingly refer to me as the absent-minded professor. And she would say, you can focus for so long on the things that you're so excited about, but then you'll forget to pack your backpack the night before, or you'll put things off and then you'll be up until 3 a.m. trying to finish something frantically. And she was so worried that these things were going to stand in my way as an adult. And in some instances, there were experiences I had where they did, and I had to learn how to work around a lot of those weaknesses. We typically will see that when college students enter into higher education, despite being very bright and talented individuals, they have a different trajectory in terms of achieving milestones, because when they were younger, they were well able to compensate for their difficulties. So when I was in high school, I was generally well liked by my teachers. They tended to want to give me the benefit of the doubt. They knew that I was, a hardworking person, but that sometimes I just kind of struggled to get it all done on time. Well, when I entered college, I knew that that wasn't going to be realistic, and that my professors were not going to have that kind of an outlook. And that's what we see for a lot of individuals, is that they tend to be able to get by because we know that they're hardworking. We know that they want to do, and we know that they're capable of it. But when it comes to push versus shove, other individuals in their life don't give them that benefit of the doubt. And in addition, we do see that the core features of ADHD can be misinterpreted by others. So whereas my high school teachers saw me as a really hardworking, nice kid who tends to just be a little bit forgetful, my college professors may have seen me as unmotivated or lazy or arrogant, because they didn't always see me engaging in the kinds of activities that they thought would be appropriate. Now, another area that I think is extremely important to talk about, especially for young adults, is driving. We tend to forget how many cognitive skills are related to the act of driving. We know we have to pay attention. We have to be able to react quickly. We have to be able to constantly be aware of our visual field, what's going on in our environment. Is the person in front of me putting on their brakes? Is there something going on over here? Is there a merge coming up? We have to be able to gauge our distance away from other cars so that we don't have a collision. And we know that there's a lot of very fast decisions that we have to make, and that even small blips in our attention can have a very significant negative impact on our driving overall. And that's essentially exactly what the research shows, is that when we look at driving knowledge itself, individuals with ADHD and non-affected individuals, they're the same. However, the individuals with ADHD often see themselves as poorer drivers. We see that they tend to have more crashes or scrapes, even on driving simulation tasks. When we look at more practical or day-to-day experiences, we see that individuals with ADHD have far more likely to have speeding tickets, more citations, they'll have a greater likelihood of having a suspended license, and that their accidents are more frequent and more severe, and they're far more likely to be at fault. Now, we had mentioned a little bit before some of the effects of stimulant treatment, and what research is showing is that stimulant treatment is found to improve driving skills in both teens and adults who have been diagnosed with ADHD. One of the other areas is the familial and romantic impacts of this. We've talked quite a bit about the emotional aspect of it and how it can impact people socially, but we know that even platonic or romantic relationships can be significantly impacted here. And again, what we know is that many individuals with ADHD have deficits in social cause and effect. They struggle to think their actions through and anticipate what the reaction may be. Couple that with some of the emotional irregularity that we talked about before, that hot temper or that low tolerance for stress, and that's going to cause a lot of discomfort and discord within a relationship. Many times individuals on the spot can't think of appropriate solutions to given problems. They might use the same approach even if they know that it's not going to really be effective. In addition, we know that impulsivity can be related to risky behavior, and that includes things like risky sexual behavior, and they're more likely to experience marital disputes and separations. When we look at families with ADHD, one of the things that can add to a lot of tension is that since we know that it tends to run in families, it's likely that more than one person in the household is going to be struggling with attentional difficulties. Again, not to draw too much on my own experience, but my father and I are both an absent-minded professor, whereas my mother is highly organized and detail-oriented. So she would often be struggling with the two of us leaving the house without, our raincoats or our briefcases, or forgetting our phones, or losing our keys, or not being able to find something, or forgetting important dates and not realizing that we had to be somewhere at a certain time, or mismanaging our time. And that could cause a lot of strife and a lot of difficulty. Now, one of the benefits that I had experienced is that I had a parent who had learned to be successful. He could teach me ways to regulate a lot of these weaknesses, and he recognized the same things he'd experienced as a younger individual in me. So he could help me, and I had a highly organized mom who was very motivated to make sure that I always used a day planner, which I still thank her for. But again, we can see that there can be a lot of chaos in terms of family relationships because of all of these factors that we've been discussing. So I've talked a lot about some of the weaknesses and what we should be on the lookout for, but let's talk a little bit about what do we do to help? Well, let's start out with what role does a neuropsychologist play here? So neuropsychologists, we essentially specialize in evaluating the relationship between our behavior and our brain functioning. I want to understand how other people learn and how they see the world. The way that I do that is I assess all areas of their cognitive functioning. So that includes like your general IQ, your expressive and receptive language. I'm going to look at your fine motor skills. I'll look at your visual spatial abilities and your reasoning capacity. I want to look at your memory, both verbal and visual. I want to look at your executive skills also. I'll look at your academic functioning and your social emotional skills. And I put all of that information together to develop a unique profile of someone's strengths and weaknesses. I don't just use that to diagnose people. I also use it to guide treatment, because it's great to put a label on something and be able to know what something is called, but it's far more practical and far more important to be able to make sure that we know what we can do to help somebody. So when we think about some of the skills that we really want to look at, we try to take everything into account and not just think about a person from an academic perspective or from an emotional perspective. We try to take everything, including medical history, culture, all of these different things, so that we can assess all areas of an individual's functioning. So when we think about some of the recommendations that we can provide, especially to parents, to teachers, to individuals that are involved in someone's care, one of the best things that I can say across all domains is implement structure and routine as much as possible. I tend to explain individuals with ADHD or executive dysfunction as individuals who lack this internal structure. And the way that we try to teach somebody to work around that is to show them what structure looks like and try to build in a lot of predictability in terms of their day-to-day. We want to, for many individuals, especially teenagers, reduce access to short-term rewards. Now, a lot of times the short-term rewards that I'm talking about in session tend to be cell phones. They are an amazing technological advantage, but unfortunately, they're also extremely distracting. So one of the things that we want to do is modify your environment. If you have your cell phone, I want you to turn it on Do Not Disturb. Put it across the room so that if you need it, you can get to it, but it's not right next to you where all of your Snapchat alerts are going to distract you from the math homework that you're supposed to be doing. Keeping things like a calendar, a dry erase board. A lot of the techniques that I'll talk to parents about involve showing a child what are the skills that you use to be a successful adult day to day. Modeling, especially in terms of social modeling, is a really great tool for learning. Kids do what they learn. They learn what they live. So we need to show them what we want them to do. Essentially, we want to train students in these volitional skills to help them to overcome the weaknesses that are there. Now, when we think about trying to achieve goals, break things down. So a lot of times people will come into me and they'll talk about wanting to be more organized. And I'll say, well, what does that mean? Does it mean that you want your room to be organized? Your backpack to be organized, your locker to be organized? Do you want to be on time all the time? Do you want to know what assignments you have due throughout the month? That's a really big concept. So let's break it down and start one step at a time. And that's something that parents can help kids to do, just brainstorming. So I want to be organized. Well, should we start with your backpack or should we start with your room? And it's not punitive. It's more of just guiding them. Now, in terms of college students, having a consistent study schedule, having a consistent routine is extremely important. Even things like keeping color-coded folders and notebooks can be really helpful to make sure that you're not bringing the wrong thing to class. A lot of times, again, using techniques to change your environment, studying in a place that you know you're less likely to be distracted. If you know that your dorm mate is really loud and you tend to have a great time together, but you know you're going to get pulled into playing Xbox, maybe it's better to schedule a study session at the library. And try to break things down over time. Don't try to study all at once. Cramming does not work. It's just going to cause you stress. Now, again, using a timer, I think, is a really great way to break things, especially study periods, down into manageable chunks. Many times I'll advocate, for people to set a certain amount of time, whether it's an hour, a half hour, work consistently for that time. Focus on just the quality of your work, not about getting it done, just the quality of your work. And when that timer goes off, take a break, walk away from it, because this way you're engaged for that period of time and you build in small breaks to make sure that you're continuing to pay attention. And similarly, an on-task timer, or there are a lot of great apps that include little alerts that perhaps you're supposed to start studying at 3. Well, at 3:10, and a little alarm that goes off that says, you should be studying, can be helpful so that if you're in the middle of checking your Facebook, that'll pop up and remind you, ooh, I should really get back to that. Now, there's been a lot of talk about things like computerized interventions, particularly CogMed and some of these other computerized games. And the reason I want to bring it up is because a lot of parents ask me about it. And what we see right now is, while there are some positive findings, really the issue lies in the generalizability. Essentially, when we see gains that are made on these tests, they tend not to be transferred to a person's day-to-day life. So we might see them improve on the game, but we don't always see them improving on like getting their assignments in on time. So there's still a lot of work to be done in that domain. And there's certainly some areas where it can be very helpful, but generally it's not there yet. Now, I've listed some books and websites, just things that I've found to be very helpful, things that my parents that I work with have been found to be very helpful, as well as some useful apps that can be found through just your general app store that can be really, really helpful. And I also have a list of my references. So I hope that that has been helpful for everyone, and I wanted to make sure to leave a little bit of time for us to go over some questions from everyone and then clarify anything that I can. So I think that is a good time to start talking about any questions I can help to answer.
That was wonderful. Thank you so much, Dr. Murphy. That was terrific information that we just heard you deliver. And we do have some questions, so I'm going to jump to these questions right in. The first question, you may want to refer them someplace. It's a question on medication, but I'm going to ask it anyway. This is an adult, and they're about to start Vyvanse for inattentive ADHD, and they also have a significant anxiety, and they take additional medication for that as well. And they know that there's a high tendency for increased heart rate and or blood pressure. And so the question is, will these side effects stabilize as the body gets used to the medication?
So it's a great question. And I do want to just clarify, I am a Ph.D. I am not an M.D., meaning that I do not dispense medication. And really, I'm going to refer you to speak to your provider. Talk about your concerns, because it sounds like you've done a really great amount of research and you have an excellent question. And I really think that it's important that you talk to your doctor about it directly to say, what exactly do you think is going to happen? I'm not able to answer that question right now, but I truly encourage you to reach out to your provider and ask it, because it's an excellent question. And it's really great to see that you've taken the time to make sure that you're researching what treatment you may be on before you begin it.
Okay, thank you for that. I have additional questions here. I know you talked a lot about executive dysfunction, planning and organizing, decision-making, those types of activities, and the effects of ADHD and executive function, where you individuals that have both are far more likely to have academic difficulties and occupational experiences. And this question for this individual here is, they want to know if they are able to complete goals, but this is quite difficult because of time management, organization, planning, and working memory. Would it still be considered an executive function issue?
That's a great question. And a lot of the things that you just described are certainly areas that fall under the domain of executive function. So while I can't, make a direct assessment, because I tend not to talk too much about people that I haven't met yet, really what you're describing does sound a lot like executive dysfunction. And certainly we know that there are a lot of aspects to that. And one of the things that we know is that, yes, are you able to complete goals? Do you have the capacity to do it? Absolutely. But one of the things that may be very beneficial is working with either an executive functioning coach or a similar professional to teach you some of the skills, identify what are the patterns of behavior that are getting in your way, and what can we do about it? Because for many people who have those kinds of difficulties, what we do is we teach you the behaviors to work around your weaknesses. Because we know that we can't, quote unquote, cure anything right now. We can teach you ways to be successful despite the fact that you have those difficulties.
Okay. Thank you. Thank you. Question here on obsessive compulsive disorder. The question here, Dr. Murphy, does OCD diminish chances to overgrow ADHD in adulthood?
That's an excellent question. We know that OCD and ADHD, like many other anxiety disorders and mood disorders, do tend to co-occur. But I'm not sure off the top of my head whether there is a unique contribution in terms of whether or not you could outgrow those deficits. What I may think, based on the research that I am aware of, is that because we know that the anxiety that is a core component of OCD can have a really significant negative impact on our attention and executive functioning skills, it's likely that while the OCD persists, we're likely to see a lot of issues in attention and executive functioning secondary to that mood concern. So it may simply rely more on the access to treatment, as well as, how long those difficulties are persisting over time.
Interesting. Okay. Thank you for giving that information. That's very good in terms of giving overall description on that. In terms of, you have a young person here who has ADD as opposed to ADHD. How does that differ?
That's such a great question. So when we think about how we used to conceptualize ADD and ADHD, essentially what we've done is, when I talked a little bit about the subtypes, and I said that there's a combined one where we see inattention, we see distractibility, we see impulsivity and hyperactive behavior. And then there's two others, one that we call primarily hyperactive and one that we call primarily inattentive. We know that now what we used to call ADD, essentially just attention deficit disorder, that essentially is where we see primarily inattentive symptoms. People with that kind of a disorder really exhibit a lot more difficulties in the executive functioning over time as well. So the core deficit, or the core difference now, is that we call it the same thing, but we think of ADHD essentially existing on a spectrum. At one end, we have primarily hyperactive and impulsive. On the other, we have primarily distractive and inattentive. And then falling in the middle is the combined type. So you have the same disorder, you just have a very unique presentation of it where we don't really see as much impulsivity or hyperactivity as in other people.
Okay. We still have some more questions. We're going to try to get a couple of these questions in before we end this evening. Right. It's generated a lot of interest.
Wonderful.
Yeah, absolutely. Tests. And this person's asking about tests. Are there tests that we can utilize to identify deficits in executive functioning skills for children or ourselves?
Yes, such a great question. Now, the interesting thing about the tests that we use is we rely on two sources of information. We rely on behavior rating inventories, so essentially questionnaires that I often will give to the patient, depending on how old they are, to teachers, as well as to parents, to get a better understanding of what exactly do you see day to day at home. And that can be a very useful tool there. And there's many different questionnaires that we will rely on to gather that kind of information. The other source is from traditional testing sources. So there's a lot of different tests that will look at things like mental estimation, that will test working memory, that will test problem solving, among many, many others, things like response inhibition, all of these things that fall under a neuropsychological evaluation, because it's essentially what we look at when we look at attention and executive functioning. So there certainly are tests, but one of the greatest sources of information that I look at is what are parents and teachers and patients talking about in terms of their day-to-day life. Because I know that when someone comes to see me for an evaluation, it is a very short snapshot period of their life. It's usually very quiet, it's distraction-free. So sometimes what I can see is that if you put someone in the right environment, they're best able to show their skills. But I need to know, what are you like in a classroom with all of your classmates trying to pay attention in science class? But certainly there definitely are tests, and it depends on which ones the examiner prefers to gather that kind of information.
As a follow-up to that, Dr. Murphy, who's actually can administer that type of test that you're talking about?
Now, typically, when you have someone that's administering it, it's generally a clinical psychologist or a clinical neuropsychologist. I do know that many excellent school psychology colleagues that I have will also talk to families about executive dysfunction, because we know that teachers can certainly see disorganization and poor time management and all of these things day to day, but many times they don't have either the access or the time to really go in depth. So the people that you're going to go to if you need a full evaluation, I would refer you to a clinical neuropsychologist, because they're able to look at all of those domains, and we specialize in the assessment of cognitive functions such as that. And then we work in tandem with the school to say, here's what our data shows. let's translate that into day-to-day practice to help you.
Okay. We have another question here, Dr. Murphy. This one dealing with sleep or reduction of sleep, and the when you don't have as much sleep, the lack of sleep or reduced sleep, will that affect, or how does it affect an individual struggling with ADHD?
Oh, such an amazing question. I'm so glad that this topic came up. Sleep is extremely important. It affects all areas of your functioning, and I cannot emphasize that enough. I want everybody to think about the day that you had the worst night's sleep trying to pay attention in a calculus class or something. I don't know about anybody else, but I can barely learn out of one half closed eye. And that's kind of the analogy that I like to use. We know that sleep and chronic fatigue, that can have a significant adverse effect on even a neurotypical or like a non-affected person's attentional functioning. So for someone with ADHD who's also struggling with poor sleep, it's just going to be compounded. It's going to be so much worse. And what we know is that a lot of times we have poor sleep, then we have issues with our attention, and then we worry, we'll get anxious about, I can't pay attention in class, or I missed something that was going on, and then that causes then poor sleep because we're worried about it. So if you're having difficulties in terms of regulating your sleep, please definitely talk to your provider, talk to your psychologist, whoever you can that you trust, to work on improving your sleep hygiene, having a consistent sleep routine, having a relaxing pre-sleep routine, trying not to use your cell phone or your tablet at least 30 minutes beforehand, because we know it's so stimulating and it can really interfere with our ability to fall asleep. So if you're having issues there, I would not be surprised if we see that your ADHD is really being significantly exacerbated or amplified.
Yeah, great. I'm going to keep going forward with some of these questions. We have a really excellent dialogue that's going on here with these questions. Parent here has a question about classroom sizes. You know, you send your child to school, and there's so many combination of restrictions, et cetera, that you can put into place. But this question is smaller class size recommended for children struggling with ADHD? Having a smaller class size.
It's a very common question. Now, many times we would think yes. And one of the reasons that I say that is simply that we know in a smaller class size, you're more likely to be able to access a lot of teacher support, and you're going to have less distractions because you have less classmates. But the other end of that coin is that many times the only way to get a smaller class size is to go into a more specialized or restrictive class setting. And sometimes that can have a lot of cons just on its own. It can have a lot of issues because sometimes the instruction is a little bit different, or a child has a really adverse reaction to thinking about switching their class. So typically, do we recommend smaller class sizes or placement in something like an integrated co-teaching class, where we have maybe the same amount of students, but we have both a regular education and a special education teacher? Absolutely, because we want these individuals to be able to access teacher support and have as much oversight and support as they can to facilitate their ongoing learning. But we also have to recognize that sometimes school districts are limited in what they are able to provide, and so it can really depend for the child and for the district that they are in.
Okay, good. Looking at ADHD here, there's another question. Years and years ago, there was really no medication for people could take to really control the ADHD. But now that they do have help in terms of medications, et cetera, but the ADHD, does that ever really go away?
You know, another really interesting question, and the answer to it is complicated. And it's complicated because we do see that in many individuals, as they get older, we think about it as falling off the spectrum of ADHD. They fail to meet criteria. They don't have as many significant impairments that stop them from engaging in daily life. Whereas for other individuals, these deficits persist over time. So in terms of going away, it's likely that it doesn't completely disappear all the way. Probably the phenomena that we're seeing is that people who receive adequate treatment are best able to learn to overcome the difficulties, learn to manage the symptoms that they live with. And like any individual, you know, whether neurotypical or impacted in some way, we all learn to play to our strengths, meaning that we're going to find the areas that we thrive in. And if we have a strong social support network, if we're taught the best strategies, if we have access to things that we need, we're going to thrive. So do we see it that it completely disappears? It's unlikely. We really don't think about it as curing. We think about it as more of a lifelong disorder, but we do know that there are certain ways that we can best optimize someone's functioning, and that's by early diagnosis and early behavioral intervention, and in some instances whether that's treatment is medication or not, that's also something that's involved.
Okay, I'm going to take one final question here, Dr. Murphy, a final question for the evening. Would you, a person who's struggling with ADHD and all the issues with executive dysfunction, would you suggest that they talk to the college or to the employer about these issues?
Again, oh God, these questions are amazing tonight. I am so excited. So again, it can really depend on the individual. For many of my college students, if you have documentation of ADHD, whether that's through your primary care, whether it's through an IEP or 504 plan through your school, or whether it's through a neuropsychological evaluation, it can be very beneficial to release that to the school simply because it can entitle you to certain services, whether that's testing in a separate location, whether it's extended time. And a lot of times colleges won't provide those services unless you disclose that. The one thing that people have come to me and have expressed a little bit of concern about when it comes to talking about that with their job or their boss is they fear that that will cause a negative stigma. And that's where I think it really depends on your relationship with the organization, whether or not you feel that these concerns may impact you, and whether the idea of disclosing this is more beneficial than any possible negative reaction you may get. Many times I encourage people to talk to a therapist before making that decision, or really thinking it through of what could I gain from releasing this kind of information. We know that for schools, it's going to be something that's held in confidence. And in terms of work, there definitely can be some instances where there is a negative stigma that's placed. Some people that I've worked with have talked about feeling that they're left out on projects, or perhaps they're not chosen to lead certain projects, and they feel that it could be because people feel like that they don't have the ability to follow through with it. So in terms of answering that, I think it really depends on the individual, it depends on the job, and it depends on the possible pros and cons of each situation.
Thank you, Dr. Murphy. And I just want to point out before we close out this evening that if we did not get to a question tonight, the question will be posted on our blog, and Dr. Murphy will be able to answer that by January 30th. So please check the blog on that. And I just want to say thank you so much, Dr. Murphy. This was actually wonderful. I want to thank everyone for attending this evening, for your wonderful questions that you presented. It was a great presentation. And now I'm going to turn it over back to Kelly Tebow for the final wrap-up.
Okay, well, thank you all for joining our webinar on exploring and managing the impact of ADHD across the lifespan. There is an exit survey which we need everyone attending to fill out. The webinar blog is open now and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to the site. Our next presentation is Post-Traumatic Stress Disorder, unpacking the myths about trauma and exploring solutions, presented by Dr. Zachary Infantolino, and it's scheduled for February 27th, 2019. This ends tonight's webinar. Thank you, Dr. Murphy, for your presentation, and thank you, everyone, for attending. Good night.